Echo, what are you going to find on actual ultrasound of the heart? Well, you're going to find a enlarged left ventricle. What about the EKG? It'll show you what's known as left ventricular hypertrophy, but how do you know? How do you know? This is going to be what's known as left axis deviation. Do you remember this? I know many of you have done this with EKG. You've gotten thumbs up, and you've done one thumb up and one thumb down, right? So what you're comparing here is lead 1 and AVF. I'm going to walk you through this quickly because this is a physio. I expect you to know this already. Lead 1 and AVF. 2 thumbs up, fantastic. You're in normal axis deviation. Normal axis, approximately 60 degrees. There you go. If lead 1 is thumb up, AVF is thumb down, that's not good. Your left axis deviation, that'd be left ventricular hypertrophy. At least know that axis deviation before taking any type of licensing exam, please. Management. What are you trying to do? Well, you want to make sure that you get that stenosis as early as possible. Try to see as to whether or not with blood pressure medication, but caution must be utilized. Ultimately, though, if your stenotic aortic valve is bad enough and you start getting into heart failure, then the only method of truly correcting your patient is through surgery and replacement of that aortic valve. Lastly, the rule of 5, 3, and 2 is extremely pertinent. If the patient die within 5 years, you're thinking about angina. Why is that angina once again? Tell me about the left ventricular thickness. It's increased. That's a lot of muscle in which you need to supply oxygen. What if you can't properly? Well, if you do not replace that valve, your patient is going to die within 5 years. Rule of 5. If the patient has syncope due to aortic stenosis, that's not good. Mean to say what? Feeling dizziness? Why? Lack of cardiac output, right? Not good. And so therefore, 3 years, if not properly replaced. If the patient and the doctor was negligent or the patient waited long enough before coming in to see you, and the patient now shows you signs of congestive heart failure, if that valve isn't replaced, a measly 2 years. 5, 3, 2. Pretty much everything that you need to know about the pathogenesis of aortic stenosis has been discussed in this lecture. If there's any questions that you might have, you might want to go back and review some of that physiology so that you bolster every aspect of what you need to know here. You're in good hands. Just make sure that you use your resources properly.